Good evening, ladies and gentlemen, and welcome to another edition of TBR. I'm George Binns, and we're continuing the introduction of the women of WOAMTEC. And we have with us this evening
Lisa Kesselman.
Lisa Kesselman, and she brought with her husband, Dr. Howard Kesselman. Welcome. Now,
thank you.
You've got a business over in the Cummings Center, Siana, which is a very elaborate spa. It's not the usual get a haircut and a trim
That's right.
kind of thing. So what's your main focus in this spa?
So we've been open since last January, and we love the area of Beverly and the North Shore. Siana Aesthetics Medical Spa. We have a full line of medical services and esthetician services, and our offerings include neurotoxins, Botox, fillers. We do hydrofacial, which is an exciting new technology that we just added. And we also do some of the other medical services that Howie can elaborate a bit on.
Yeah. Well, you've rattled off a bunch of different things, and we've been discussing them. I have some idea what you're talking about, but exactly what are these things? When you say you're going to give them a Botox, what do you do? Do you do it, or does the doctor do it?
So we're overseen by our medical director, Dr. Kesselman, and we have a whole team of experienced nurse injectors and licensed estheticians. So
Licensed what again?
Licensed estheticians.
So the
focus on
neurotoxin injections
skincare.
are either myself or the nurse injectors. And Botox is bacterial toxin that causes botulism.
Oh, yeah.
Yeah, but we're using 1/1,000,000th of a gram. So
Yeah, the whole name of the game is just
a billionth of a gram.
relax the muscles just
Exactly.
a little bit.
Yeah, exactly.
Smooth your forehead.
Yeah.
Yeah. So these muscles that create the furrows in the brows,
Yes. Make me look old.
make you
Yeah.
distinguished, but
Yeah.
So-
Look serious.
So that's part of it, and what we like to do is have a holistic approach to our clients and individualizing their plans and their goals. But with the neurotoxins and the fillers, where the nurses are maybe relaxing your muscles to smooth out your forehead, or possibly lifting your cheeks as you get older, your face starts to droop and all of that. We also feel
Will
that...
Botox lift your cheeks?
What?
Will Botox?
No, the Botox is going to relax your muscles
Okay.
on the forehead. Your fillers are more of a hyaluronic acid-based product where it gets injected and it lifts and contours.
So it's like a fat,
so
replacing the fat in your skin?
well, right. So you're losing fat and elastin and collagen
Yeah.
with age. It's getting
I
hollow
know
in the
about
eyes.
it.
But the hyaluronic acid is part of the matrix of what we call the dermis, the lower layer of skin that everything is kind of built on,
Yeah.
that scaffolding that has been lost. But hyaluronic acid attracts water. So a quarter of a teaspoon will hold 1.5 gallons of water per
Okay.
week. So you're basically
You're rehydrating.
you're
your face.
rehydrating, volumizing. Yeah, you're
Yeah.
you're replacing that volume with something that's hydrophilic, that attracts water like a sponge and holds
Yeah.
it for months.
Yeah.
So all of the nursing side of it, where you might be redefining contouring and that sort of thing, is one side. The other whole half of it is the aesthetics. The estheticians deal with the hydration and the nourishment of your skin,
Yeah.
and those two things need to marry each other if the client really wants to reach their optimal results.
Okay.
So that's where the good skincare and our medical grade skincare line ZO comes into play at that point.
Well, that gets into your line of skincare products
Mm-hmm.
that you. Is this something you developed, or is this somewhat standard?
No. Dr. Obaji, who is a very world-renowned dermatologist who developed the line, and you have to be a medical spa to carry it, and the big focus with it is it's medical grade, so their percentages are higher, and their ingredients are top-notch. They've done years of research to come out with these products that really complement all the medical type services so that you're, again, reaching your optimal results. And we come up with an individualized plan for every client, whether they're female, male, any age, and that's how the skincare line is designed to tailor to that particular person.
You've used this term several times, a medical spa. What's the difference between a medical spa and a plain old spa, whatever you call them?
So a medical spa,
Mainly hemp.
well, yeah, so neurotoxin, botulinum toxin, as you would imagine, requires a prescription, hyaluronic acid. These are considered medical procedures. The use of laser, the availability of products with high concentrations of things like retinol and other things that treat skin conditions, whether it be brown patches, pigment problems. So in a general spa, you might get facial treatments to a certain degree, but in a medical spa, they become more advanced, more complicated, and you can do much more. And none of these other things, whether it be laser, Botox, fillers, those are not going to be available.
So you don't get this in a regular spa? So.
No.
No, it has to be
Because
medical.
what you're essentially saying is you have to have a doctor supervising
Yes.
the operation.
Yes.
Correct.
And it really is an operation to a certain extent where you're making injections and
Also taking care of your skin, and we like to believe there's an 80-20 rule where, you come in, you get, your services, whether it's the nursing side or the aesthetic side, and you need to also go home and have a good regimen. So if you're not doing your good skincare at home, you're not, again, reaching your optimal result. So we do a lot of coaching on that as well, so everyone can really,
It's like
feel
buying an
empowered.
expensive car and parking it under a bird's nest or a tree,
yeah.
And
You
it's
gotta
also
keep it
not,
up.
right, and it's also not just about the outside, how you look. We also, and this is going to be a big focus for us in 2024, it's also the wellness side, which we've been rolling out and focusing, and Dr. Kesselman's going to talk a little bit about it, anti-aging peptides, functional medicine, and we have a weight loss program that's supervised by Dr. Kesselman, and that's been very, very hot. People are really looking to better themselves, get better behaviors, and change lifestyles. So we hope to, empower people to be their best outside and inside.
Well, there's a big spread in the news these days about all the various weight loss medications. Is this something you deal in, or do you have a different approach?
No, we're when it comes to prescribing weight loss therapy, where appropriate, we're using what are called glucagon-like peptide agonists, of which semaglutide is the best known. There are several. The majority of patients who are on a medication weight loss regimen are using semaglutide.
Yeah. So again, this requires a doctor's
Yes.
prescription. Then that's
And
what you're
supervision.
there for, among
Yeah.
other things. Yeah.
And to stay on top of it, see how they're feeling, make sure the dose is appropriate, make sure they're tolerating it, make sure they understand the behavioral lifestyle changes that complement that medication and will guarantee more long-term success.
Well, what kind of lifestyle changes do you coach them in?
Well, it's more making sure that people understand these medications work primarily by suppressing appetite in the brain, suppressing cravings, slowing transit time for food from your stomach so you feel full earlier and with less food. And that's obviously one important component of weight loss is just less calories.
Yeah, it's all calories.
It is all calories, but on the other side of
don't-
that, when you take that medication away and you don't make any changes, it will come back. So
Yeah.
So people need to understand that with this, this will allow. So for some people, it's very hard to change eating habits, but it's much easier to learn new habits when your cravings are controlled and you don't feel hungry, and also to introduce exercise, because if you're not doing something different and you just simply stop taking the medication, you can be pretty sure that there's 80% of people will gain their weight back over
Yeah,
time.
it's just a simple matter. You're pumping calories in unless you burn them off
Exactly.
with exercise.
But there are a lot of people who are severely overweight, and I think the jury's out. There are studies looking at whether it may make sense to keep some of these patients on long term, given the severity of weight loss, morbid obesity is as serious as many diseases.
Yeah.
These drugs have been around for several decades, managing diabetics, and they're safe. Used appropriately, they're safe, and if they're well tolerated, there are some people who will probably end up staying on either that medication or some modified dosing regimen going forward, because the health consequences of gaining it back are just too overwhelming.
And
It's a heart attack.
Right.
And that's
the
cancer.
usual one that you're concerned about.
And I think so many people, think they're going to come in and get this quick fix. It's all about like a journey and changing behaviors and going slow, losing a few pounds a week and moving forward like that, getting used to a few walks a week, and then it's going to stay off.
Yeah.
It's when people think they're going to get a quick fix, lose, 10 pounds in a few weeks, and then they're going to go out and eat cheesesteak subs again. You can't do that. You have to change behaviors, and that's what we mean by that.
Well, that's what you see in the ads on the TV, that lose 11 pounds in a week.
Yeah.
We're shooting for maybe a pound a week. But the other part of this, and this has really been nice about being in Cummings and being in Beverly, is that this and other parts of our functional medicine program have enabled us to form collaborations with other practitioners and people within this community, so nutritionists, physical, personal trainers, and
Vitamins, like with Lolly Leeson.
the local compounding pharmacy. So we've formed some exciting collaborations and are always looking for more. So that these people help us, and we like to refer them to a nutritionist.
back
and
well,
forth,
going to a nutritionist is the most ideal. Going to a personal trainer or joining the gym, which there are several nearby. So these are all working together, and the community in Beverly has been very welcoming. And Lisa's connections through the chamber and WOAMTEC have helped that quite a bit.
Yeah.
Networking is huge. And we live up here. We live in Swampscott. So being part of Beverly and the North Shore, that was a big reason why we moved from the South Shore to the North Shore, so that we could network, become part of the community, and really, form relationships like how he's talking about, so that, it's all being entwined in the woodwork and being a part of the community.
As you say, it's a lifestyle change that they're going through. And at the same time, they want to look good doing it, and don't want to look like that.
Yep.
It's not a trauma, and so you're essentially reaching both sides of the issue. How do you maintain your personal image at the same time that you're doing something very positive about your basic physique?
And that's a good segue actually into the functional medicine side of this. So functional medicine, which is becoming more popular by the day, by the week, by the month, really seeks to turn upside down the traditional doctor-patient paradigm, where you go to the doctor because you're sick. You only go when you're sick to find out what you got and to get something to get you better.
Yeah.
The functional medicine approach is, why did I get sick? Why might I get sick? Basically, it starts at that baseline rather than treating you the problem has arisen, and you, through consultation and directed laboratory testing, you try to uncover vulnerabilities that there's an individual assessment of a particular vulnerabilities to conditions, deficiencies, and that may be lurking, that may be causing problems now that you're not aware of, or causing problems down the road. We follow baseline inflammatory markers. We look at, when appropriate, certain genes that are associated with vulnerabilities, particularly looking at those that are actually can be modified by, or outcomes modified by nutritional interventions or lifestyle or exercise, measuring hormone levels, and coming up with a patient-specific prescription that's much more holistic, and it may or may not tie into what we're doing here, but looking at nutritional and micronutrient deficiencies, enzyme pathways, whenever appropriate. So it's very patient-specific in which direction that you go. We're working with William Beckman, who is from the Custom Medicine Pharma Center, introducing a bioidentical hormone replacement therapy, which again will be tailored to patients based on their own hormone levels and age symptoms that they're having. So our goal is basically, there's that old Billy Crystal line from Saturday Night Live, it's better to look good than it is to feel good.
Yeah.
But if you can feel good and look good, that would be the most ideal. So our goal is to make you look and feel your best. And that's where this really aims to come in, to try to, if you don't feel like you should, or you want to feel like you should, there's more and more technology and more things and interventions that are possible in that regard.
Well, it sounds like you're doing blood tests and you're taking DNA samples.
At times. It's not, most people don't actually require that, but you may require at least
Oh, you're
blood tests.
talking like the hormone levels. How do you figure that?
Well, you actually can do that from saliva or urine.
Okay.
Blood actually doesn't give you, it's hard to get, hormone levels fluctuate over a 24-hour period, so
Yeah.
You either have to be drawing blood frequently, or there are other ways of gathering it. So,
You provide this kind of a service.
yeah, and we assess if that's what the issues are. That's not everybody's issue.
Yeah, I mean,
Yeah.
again, we're
That's
looking at
that's part of the functional medicine
what is the
side of
breadth
this.
of your operations. What I'm trying to get to
Yeah.
is that, you can, if this is required, you can make it happen. And part of the game is you have to make an assessment of what do you need to understand this
you discuss
situation.
with patients what their particular concerns are, or what those issues are, and then to pick a diagnostic pathway to investigate that, and what you find you share with them and discuss.
Yeah.
And then you can decide whether any intervention is needed at all. I think semaglutide as a weight loss is its own decision based on history of obesity, failed attempts to lose weight by other means.
Mm-hmm.
Often the presence of significant comorbid problems, sleep apnea, hypertension, diabetes, other things that contribute to their risk of bad outcome or dying. So that's kind of its own decision pathway.
And one of the things we offer are free consultations with Dr. Kesselman, all of our nurse injectors, all of our estheticians, so that we can identify what your goals are, so that we can mutually come up with what the best plan for you is. Because not everyone comes in for their forehead or their skincare. Sometimes they come in because they just feel so sluggish and they would really like to do something.
And I just want to emphasize you don't necessarily, you're not like on a conveyor belt where you first do the aesthetics and then you swing around to the functional medicine side. That is a capability and expertise within the office, but plenty of people just come in to look good.
Yeah.
Yeah.
So I think this is one of the things that I think is missing, that when you think of you going to a spa, you want to fix something. Your lips are not full enough, so you got to get an injection, or you got wrinkles you want smoothed
You
out.
can make a commercial for us.
Yes.
Yeah.
And at the same time, you're going beyond this into, okay, what about your lifestyle? Is it comfortable? Is there something that's physically limiting what you want to do, like excess weight, lack of energy? I don't know, you probably know more of the symptoms than I do, but the operation is broad enough that you can take the Botox shots and take care of that, as well as the rest of the person. And how much farther can you go with this?
And that's exactly it.
And I guess, at what point do you say that, hey, it's beyond our capability, we need to refer you to somebody else?
Absolutely. So, for example, when I was saying you go to the doctor when you're sick to treat a particular problem, to get back to this baseline, functional medicine looks at that baseline and says, how do I not get sick? Or why do I get sick? Yeah. So if you have a medical problem, all these patients have their own primary care doctors, and we would refer back for any medical problem that actually got identified. So, and if you're diabetic and you have we'll send you to your doctor to get these weight loss medicines because we're not just supervising weight. We want to make sure that you're getting proper diabetes care, which is certainly something that can be done through a doctor's office, but we're specifically not setting ourselves up to do that because we don't have the relationship with these people like they have with their primary care doctor. So if you have a disease, if we identified something, we would make sure that it was communicated to your own doctor.
There's something beyond.
We're not treating disease, we're trying to prevent disease.
Yeah. So, okay, I guess that's the important point. That you want to prevent it before it happens.
Yeah.
And what you're looking for is the early symptoms that this is not the right path to be on.
Right. Or if you have diabetes and you're being managed by your primary care doctor and that's under control, but you want to work on other things, that's fine too. But the medical problems that you have would obviously need to be followed and controlled by somebody who follows you longitudinally and has that relationship with you.
Yeah. So you've been in operations since what?
A year and a few months we've been open.
Yeah. And how's it going?
It's going wonderful. Actually, we're enjoying it so much, and we're trying to do as many events as possible, promotions to bring new people in. We're hoping that your audience will follow us on Instagram at sianaaesthetics.com. We have a beautiful website, and we're easy to find. We're right at Cummings Center in their main building, in building 100.
Yeah.
And every week we're getting bigger and bigger, and referral is huge. If people come in and have the experience, they tell their friends. So, we're really building as every month goes by.
Yeah. And the nurses, Lisa, the estheticians, they really work on creating an experience when you come in. You feel very much at home, very pampered. Everybody who comes in always remarks on how much they enjoy just visiting and staying there. So
it's about relationships. It's about relationships and
a few
results.
trips to an ER and understand the possible differences in relationships.
Yes. Yes.
You get to a triage nurse and, okay, we'll put an IV in you and then we sit over there. And
so impersonal.
well, they got a different problem.
Circumstances,
Yes.
That's what triage
And that's their
is all
job.
about.
Right. Has to be.
Who has to be seen right now and who can wait a little bit.
Exactly.
And
This is different.
It's a different ballgame. And I guess what you're into is, okay, somebody who comes in for either functional medicine or just to get a Botox shot or get
Or
some
facial.
wrinkles or facial, gets the opportunity to talk a little bit deeper than just what they came in for. And maybe there's nothing behind it, but maybe there was always something bothering them that I guess you can address and say, hey, we can do a little bit to help you, we can do a lot to help you, or you're beyond our capability, you got to stick with your own doctor because we don't treat diabetes, the example you keep using,
Right.
or you don't treat heart attack.
You go to a cardiologist.
yeah.
These are some of the
We're complementary.
differentiations that you're capable of making, that we know what we can do and we know what you really need somebody else. And I think this is an important point that a lot of people don't get that message early on, that I ain't the right kind of guy to help you, or I am the right kind of person that can help you. And they're left looking at the wall, what do I do next, kind of thing. So,
And we're very conservative. We don't push anything on anyone. We like to sit, do consultation, and come up with the plan that you're comfortable with.
Yeah.
And that's important to us.
well, I guess one of the concerns that, okay, you've got a product line of treatments, and if somebody walks in, they get concerned that I only want one treatment. Next thing you know, you got this whole raft of things that have floated into their environment.
Well,
do I really need all of this stuff or not?
So consultation is free.
Yeah.
And nobody has anything done to them that they have consented and paid for.
Yeah.
So they won't wake up from anesthesia and find out that all sorts
Oh
of
my
things.
God, I had that done?
All sorts of things have happened.
Yeah.
It's not like that.
Right.
What happened to my nose?
Exactly.
I thought I was supposed to be in the middle of my face.
Generally, what happens is people will express concern about something that's bothering them to the estheticians or the nurses, and they'll get several suggestions, either complementary or different approaches, and then they decide amongst themselves with the client which way to go.
Yeah.
Do we do it with skincare and a treatment of whether it's laser, whether it's microneedling, which is another approach that is a very exciting modality. And again, consultation is free without any pressure.
Yeah. Laser is what, you burn something off?
Essentially, yeah,
No.
you're using laser most typically to either remove hair or to treat some type of pigmented lesion on the skin.
Yeah. And what's this microneedling?
Microneedling is collagen induction therapy, and we use a machine called the Pixel 8 with radio frequency. And the EM piece has small needles that actually puncture your skin to create injury, so that the cells and the growth factors and the fibroblasts will all rush to the site to do what they do, and that is to like build the collagen, do the wound healing and all that. It tightens the skin. And then post microneedling, we use an exosome, which Hal can elaborate on.
It's a curious fact
down.
that if you induce a trauma, a low-level trauma, nothing disfiguring, painful, or scarring, but a low-level trauma triggers a whole host of growth factors and mediators, so that the recovery is with the tightening of the skin and just everything that everything underneath the skin is enhanced or improved, and the addition of exosomes, which are essentially, it's a little packet, biological packet of all the growth mediators and everything. It's like an injury response bag in case of emergency break glass. It's got 100 different mediators in it, and they've been discovered in the last few years. They can be isolated from fat cells, and once you create those channels of injury, then you add the exosomes, they go in, and they go in and bomb the place with all the biological mediators that you need to enhance this response. So it's really a very, it's not intuitive that this would make you look better.
It calms down your skin too. So when you get the microneedling, your skin becomes a little bit inflamed. That's natural. That's supposed to happen. The exosomes calm that down.
Which actually is very, if sometimes you want to see it to believe it. So you've got this inflammation, you're all red. You apply the exosomes, and their face goes back to normal right in front of your eyes, and you're ready.
But a little tighter.
We say that's turning off an inflammatory response.
That's also a process. That's a series of 3 with a month in between each one.
Yeah.
But again, it's a journey. There's not like a quick fix for anything. You need to be having good skincare and really pay attention as time goes on, keeping your regimen going.
That will
at home.
give you about a year worth of response, so that's a pretty good
Yeah.
treatment.
Yeah,
Sounds
it's
like a
very,
good deal.
very popular.
Well, ladies and gentlemen,
think
you
we're gonna
know
be
where to
seeing
go
you.
if you've got a concern. And thank you very much for watching us this evening. And again, if you've got any comments, my email address shows up at the end of the credits. And if you've got a longer story to tell, we can make room for you here at the table. Thanks for watching.